Thank you. So the next person in the spotlight up here then is Ria Fujisawa from the OECD. So Ria is a health economist and policy analyst at OECD and has over 20 years, I think, experience now of conducting cross-country analysis on various health policy areas, including patient safety. So we're very delighted that Ria is able to be with us here today. I know Robert touched a little bit on, how far we've kind of come, and a lot of people will know 2008, the very seminal Madden report, building a culture of patient safety, and now we're kind of looking, I suppose, in a way of what we've built on and what the next stages are. And while that journey has been shaped, I think, as Bernard has alluded to, by many traumatic events and system failures, and I suppose that part of it, there's also been a lot of international thinking and developments in what is quite a fast evolving field in patient safety over the last decade that have shaped our journey and shaping our future. And the evidence and work of the OECD at that time, I suppose, was very much part of the birth of the NPSO in 2016. And as I say, even coming into the role in the last few months, patient safety is a fast evolving field. It likes to learn and to respond and think differently and in new ways about how we can continually manage to improve. So I think it's very, very fitting that OECD is here with us, and Ria is here to represent OECD and their current work as we look to the next chapter. So Céad Míle Fáilte, it's not your first time in Ireland, Ria, so I don't know if you're going to tell us about when you were here before, when you were, I think, much younger as a student or whatever, but you were very welcome to Dublin Castle and for your presentation here today. Thank you.
Thank you very much for having me today. Today I'm going to talk about three topics in my presentation. And first, many people may wonder why OECD, the Organization for Economic and Cooperation and Development, talks about health. So actually we are doing lots of work on health. So I will briefly introduce OECD's work on health. And second, the OECD has been working on patient safety, as been introduced, for years. So I will present key findings from our reports and statistics on patient safety. And then third, I will present more specifically on our work on patient safety culture. So OECD works on various health topics, as shown here. And for each topic, we develop indicators for international comparisons and collect data and undertake quantitative analysis using these data and qualitative analysis using policy information from 38 member states, including Ireland. Based on this analysis, we also provide policy recommendations. Within the domain of quality of care, patient safety is an important topic, and we work a lot on this area. So we have a series on economics of patient safety, and we published 6 reports. They cover topics including primary care, long-term care, safety in workplace, and medication safety. And last month, we published a report on patient engagement for patient safety. These reports make the economic case for patient safety and provides policy recommendations across different levels, including clinical, organizational, and system levels, because there is a need for all stakeholders involved to work together in a concerted manner to improve patient safety and build patient safety culture. Here are some key findings from these reports. In the hospital setting, about 15% of expenditure is devoted to treating the effects of safety lapses during inpatient care. And 50% of patient harms occur in primary and ambulatory care, accounting for up to 5% of health expenditure in some OECD countries. The pie chart on the left shows the OECD average on the breakdown of health spending. 5.4% of expenditure was spent to treat patient harms occurred in acute care setting, and 3.3% of health expenditure was spent to treat incidents happened in a primary care setting. Together with long-term care, up to 13% of health expenditure was spent to treat patient harms, and this is equivalent to 1.4% of GDP. So this is a spend, and the amount of liability payment is also considerable. And this is spending on top of health spending. According to the OECD's study this year, we found that patient safety incidents that result in litigation and settlement incurred significant costs to countries. And the magnitude of the cost is different across countries. We learned that in 2021, in Ireland, payments for clinical claims were equivalent to 3.4% of hospital cost. In the United States, medical malpractice payment corresponded to 0.3% of hospital cost in 2022. In addition to economic analysis, OECD develops indicators on patient safety, collects them, and monitor cross-country differences and time series. These data are included in our online database. You can see the link here. And OECD flagship publication called Health at a Glance, which is published every year. And the 2023 version is going to be published in a few weeks' time on 7th of November. In this publication, we include indicators on patient safety, as it is an important domain of healthcare quality and health system performance. For a long time, we've used administrative data source recorded by providers to monitor patient safety. Joint replacement surgery carries the risks of postoperative pulmonary embolism and deep vein thrombosis. And they cause unnecessary pain, reduce mobility, and in some cases, death. But these can be prevented, so we use them as patient safety indicators. This figure shows these two indicators across OECD countries. You see a note saying that draft not for circulation because this figure is going to be included in the Health at a Glance publication, which is going to be published soon. As you can see, there are large differences across countries, ranging from 57 cases of PE or DVT per 100,000 surgical discharges in Italy to over 1,000 per 100,000 in Australia and in the United Kingdom in 2021. These are important measures to monitor changes over time within countries, but cross-country comparisons are difficult since these data may be influenced by several factors, such as differences in diagnostic and coding practices, and higher rates may signal more complete patient safety monitoring systems and a transparent patient safety culture rather than unsafe care. You may be concerned about the rate for Ireland being higher than the OECD average, but the rate may also affected by these comparability issues. So in order to understand the extent of patient safety incidents occurring across countries, there is a need to use data collected from other sources, such as patients themselves, to supplement administrative data shown before. The OECD developed a survey and indicators to monitor patient-reported experiences of safety across countries. And we found that across OECD countries, up to 1 in 6 patients reported experiences of safety incidents, and up to 8% of patients experienced medication errors. So far, I showed data on what went wrong, but the growing sentiment across health systems is that measuring what went wrong in healthcare is not enough and often not productive. There is a need to measure and assess health systems' capacity and ability to deliver safe care. This is why measures of patient safety culture have been increasingly used to understand the presence or absence of safe healthcare environment in OECD countries. So just to remind ourselves on what we mean by patient safety culture, according to the European Society of Quality in Healthcare, Patient safety culture is a pattern of individual and organizational behavior based upon shared beliefs and values that continuously seeks to minimize patient harm, which may result from the process of care delivery. Agency for Healthcare Research and Quality in the United States developed hospital survey on patient safety culture. This survey asks hospital staff to provide information on aspects of their work environment and whether they are conducive to good patient safety. Many OECD countries have used or adapted this survey tool and measure patient safety culture broadly within their health systems. And these data are increasingly used together with administrative data and patient-reported data, which I have just shown, to improve patient safety. This survey measures 10 domains, as shown here, and they include domains such as teamwork, organizational learning, response to error, supervisor, manager, or clinical leader support for patient safety, and communication about error. The OECD is collecting these data from countries which implemented surveys measuring patient safety culture to analyze international comparisons. So this is a figure from Health at a Glance. This figure shows staff perception of whether important patient care information is transferred across hospital units and during shift changes. There are two versions of the survey developed by the Agency for Healthcare Research and Quality, and more than half of the countries use version 2, which was developed in 2019. Data collected from these two versions cannot be compared directly, so I'm going to focus on countries conducted version 2 of the survey. And you can see that positive perception from staff on safety, on hands-off, and transition ranges widely across countries with an over 20% difference. And positive perception is low in Korea, but high in Turkey and Colombia. This is another figure showing differences in communication openness. Among the countries which used version 2 of the survey, there are about 20% difference between Portugal and the United States. And this figure shows the domain of reporting patient safety events. The cross-country difference is significant. And among the countries which used version 2 of the survey, the share of staff reporting positively about having a culture of reporting patient safety events is low in Poland and Portugal, while it is high in Colombia and the United States. This figure shows staff perception that staffing levels and work pace are adequate across countries surveyed. But you can also see that there is a clear disconnect between perception among management and frontline staff in most countries. On average, 57% of physicians and nurses in hospital perceived staff level and work pace to be unsafe, compared to 51% of management staff. Again, this figure shows data by type of professionals. With regards to hospital management support for patient safety, there is a large difference between perception among management and perception among physicians and nurses. Among the countries which used version 2 of the survey, while 3/4 of management perceived that they support patient safety, only about half of frontline staff share such a positive perception. So a growing research finds that patient safety culture is associated with positive outcomes, including improved health outcomes, improved patient experience, and organization productivity and staff satisfaction. I've already mentioned that patient harms consume up to 13% of health spending, And patient safety culture could minimize patient harms and lower such wasteful spending. In addition, improved worker well-being through a positive patient safety culture could also lower the cost of occupational harms, estimated at up to 2% of health spending on average across OECD countries. Patient safety culture can also guide policymakers, hospital managers, and staff in improving and strengthening their culture and improving safety outcomes. Many OECD countries see a patient safety culture as a key building block for improving patient safety and quality of care. A significant number of OECD countries use patient safety culture as a key component of their national patient safety strategies as well. This is because all those who are involved in healthcare from clinical, organizational, and system levels are part of building patient safety culture together. Innovation at the clinical level is enhanced through organizational and national system level leadership. And vision and leadership at the higher levels of our government is critical to operationalize a system approach to build and nurture a positive culture of patient safety. As part of this effort, patient safety culture measurement is a significant priority for OECD countries. 2/3 of OECD countries plan to initiate or expand existing work on measuring patient safety culture. Ireland is also planning to implement patient safety culture survey, which is aligned to the ongoing work at the OECD. We think that this is one important step to further nurture patient safety culture in Ireland. And we look forward to continuing working with Ireland on this initiative, as well as others. Thank you very much.